So why is this happening? So let's go through this. So before that, let's know what exactly is menopause. What does this what does the word definition of menopause mean? So what is menopause? So crucially, menopause is neither a disease, is neither an not an illness, nor a sudden sign of premature aging or decline. So it is completely a natural biological milestone. If I may say, it's an important biological milestone. It represents the permanent completion of a woman's reproductive phase, occurring simply because the ovarian follicular phase runs its natural biological course. So now let us look at the age demographic. In what age do we see this? So usually it is said that in India, so usually there's a misconception that it happens around the age of 50. But no, in India, if you see the demographics, if you see this, if you take the statistics, it usually happens around 46.2 or 46, 44, 46, 46, 44, 46 in the age of 44, 46. But all over in the world, it goes around 50 to 51 years, in the age of 51 to 50 years. So this is also again influenced by your genetic decomposition. It again depends on your nutrition, your psychological stress and physical, your lifestyle, and other changes which also affects the other lifestyle habits, which also affects your this important milestone. So now next slide. Okay. So this so usually, so what happens is, sometimes a patient comes telling that at the age of 45 itself, she comes telling that she's pretty worried about, telling that probably she is aging pretty very early. At age of 45 itself, there are females coming telling that am I aging very fast, I don't know, something is wrong. And they think that they are 45 is not the age for them to go through these changes. But yes, we have to convince them, yes, this is a normal change, this is something which we need to accept it and adapt it and accordingly work for it, so that it doesn't become a burden. Instead, we can tackle it in a right manner. So next, first, as we enter, so let us understand what is your body going through. So to understand this whole process of menopause, let's understand this whole thing as in a 3-stage clinically. So this, first we enter into a stage called as perimenopause. So this is the transitional runaway. It can last from 4 to 8 years. Here estrogen is not simply declining, it is fluctuating widely. It peaks and drops unpredictably, which is why your periods might be light this month, next month it might go little very heavy, and or sometimes you might even skip your periods some months, right? So this is the perimenopause, and then comes your menopause itself, the exact milestone. So this is actually a precise point in time. So it is clinically confirmed when you are not getting your periods for 12 consecutive months. Your periods are absolutely stopped for 12 consecutive months. So you can understand that, yes, so you are going through this menopause. And finally, after the menopause, you have this post-menopause stage. So this is a reminder for your life. So hormones, the roller coaster ends, the estrogen level stabilize at a lower level, and our healthcare strategy shifts to protecting our heart, metabolism, and the bones. So now, why this? Why do we need to take care more about our bones, our heart, and the metabolism, and etc. So next slide. So here, so let us see why this is happening. Why during menopause we see this sudden shift, sudden change? Why this is so important? Or why do we have to face this? So here, so now let us examine a level, why this is. So why does this transition feel like so encompassing? And the answer lies in the profound system wide reach of our two important chemical messengers, that is, they are nothing but the estrogen and the progesterone. So our ovaries are the command center for these biological for these hormones. So as our ovarian follicles count naturally runs low, the production of these hormones also drops down. So it is very natural. So as our ovaries come down, even these hormones also come. But the secret here is the estrogen does not just govern your uterus. There are estrogen receptors in your brain, in your heart, in your blood vessels, and your bones, and also in your skin. So when estrogen falls, it entirely alters your brain thermostat. So thermostat is where it regulates your the body temperature. So that is again affected by the lowering as the estrogen drops. It is also affecting your thermoregulatory system as well, and it speeds up as the estrogen lowers. It is speeding up your loss of calcium. The bone calcium is lost, and it also reduces the vascular elasticity, and simultaneously progesterone. So along with that, progesterone also, which is our body's natural calming agent. So even when even progesterone comes down, so you can imagine, so we are supposed, we need to be calm, and so when the progesterone, that which is helping us in keeping us calm, that is also going down, so automatically, so there is what flares up is anxiety, mood swings, and etc. So this is the connection between the hormones and your different systems here. So usually we get patient, we get usually females around that age tell us that they feel as if they are hijacked with something else. They don't feel that it is their own body. They feel that somebody else is doing some governing their body. It is not in their control. Their emotions are not in their control. So they usually think that there is absolutely something wrong, and there is some serious problem here, and they come resorting to what can be done, or they need some psychotherapies and etc. And so that is where, when we talk to them, we understand what exactly is going on, etc. So we try to calm them, and once you accept it, once you understand your body, I think it is easy for us. Once you digest this fact and understand that, I think it is very easy for us to go forward. Okay, so next is, so let us break down this classical symptoms according to different systems, like how it is affecting various systems. Like some are neurological, and some are emotions, and etc. So just let's see. So first, coming to vasomotor system, so the famous hot flashes. So usually, so whenever we talk about menopause, the first thing which strikes to us is the hot flashes and the mood swings. So hot flashes and the night sweats. So suddenly you feel as if you're sweating for 4 to 5 minutes. You feel as if your body is feeling literally hot, and you start sweating as well. So you absolutely not able to control that, and after some time you are like, okay, you're back to normal. So why does this happen? So when estrogen drops, the hypothalamus in the brain, which acts on as your body's thermostat, becomes highly sensitive. They become highly sensitive, and your comfort zone narrows, and a tiny rise in your ambient temperature tricks your brain. So as the estrogen comes down, so your temperature, tiny, there'll be a rise in the temperature, and that makes you feel that you're totally going hot, and you feel absolutely hot all over your body. So this you feel as if your whole body is boiling, and and over that you are stressed. Again, it triggers these mechanisms. So therefore you have to you need to cool down, both mentally and also physically. There are various ways of managing these there are various strategies, the various natural ways of managing this as well. And second, when it comes to sleep and mood disruption, so, and this is actually you can call it as something like a double-edged knife. So you have knife which to both edges, you cut either on the either side, also you're going to get harmed. So that is, one is estrogen, one side is the estrogen, one is the progesterone. So what happens is, so there is night sweats, wake up, and that is lack of progesterone prevents you from falling back asleep. and chronic sleep loss then worsens daytime mood swings and the anxiety. Then so this is like a double edge. So again, so both estrogen and progesterone are not helping, are, the decrease of these both are again not helping you to sleep well. This is okay. Okay. Okay, so I'm so sorry. So this is like a, as I said, this is like a double edge. So the night sweats, they wake you up, and you're not able to calm down because of this estrogen getting low. So you're there trying, you are not able to sleep, and you're not able to keep calm because again progesterone is also low. So this is like a double-edged knife, which is absolutely disturbing. It is disrupting your whole body, the keeping your calm mechanism. So next is the cognitive shift, often called as brain fog, right? So women find themselves walking into rooms and forgetting and struggling to find simple words during conversation, etc. So usually, so this is a very common complaint which we usually females come and tell us, that telling that I try to go, I go somewhere and I end up, there's complete brain fog. You think that why am I here? You open a drawer and you just think that why have you opened the drawer or so. So that is like complete fog, and brain fog, and they think that, and they also misinterpret as, is it something like a start of an Alzheimer's disease also. So they are absolutely scared about it, and again we have to again talk to them, understand, make them understand, until unless it is absolutely very very severe, of course even that should be taken care. But usually, so it is nothing to be extremely worried about, which also can be taken care eventually with right strategies, when you involve with the right strategies. So next coming third, so while we focus on a lot of immediate symptoms, we must also look further down the road for the post-menopause, as like how to prevent, how you can have a pretty good health, and you can have longevity of your health. So estrogen acts as a protective shield for your blood vessels and the bones, and when that shield is removed, you proactively step in with a specific lifestyle disorders as well. So let's look at various systems here. So first coming to that is I've just included four critical, very important systems. So first is this skeletal system, and so in the first 5 years of our menopause, a woman might develop, she might lose almost 20% of her bone density. So this raises the risk of disorders like osteoporosis and etc. So that is where we need a lot. Sometimes we might need calcium supplements, we might need vitamin D and etc. Accordingly, you have to also get your blood level checked as well, the level of calcium and vitamin D checked as well, which I'll be dealing with that later. And then we have cardiovascular system. So as I said, so estrogen keeps the blood vessels flexible. So without it, so you can understand there is going to be arterial stiffness, which can increase or which can elevate, or it can keep you at a risk of developing a high blood pressure. And also you might also develop a few heart related concerns as well, because so as I said, estrogen, there are also receptors in your skin, your blood vessels as well. So that is about the cardiovascular system. And next, third is our metabolic rate, metabolism. So usually you find yourself bloated. So whatever you eat light, you eat heavy, or whatever it is, like whatever food you eat, you tend to be pretty much bloated always, you feel gaseous. So that is because your metabolic rate is disrupted, so which naturally slows down, leading to again there will be muscle loss. So finally, then you have urogenital system. So this is which suffers because of pelvic tissue thinning. So because of the estrogen getting low, so there is pelvic tissue thinning also, which can cause discomfort. You might also experience dryness in the vagina, and there may also be frequent UTIs as well. But after all this, at the end of all this, I would let's say, I know it sounds very very scary when you see, when I tell about this heart affecting the heart, your bones, and it all sounds so scary, but at the end, I could say that there's a good news. The good news about it is all this can be managed strategically with a right, can be managed well with right strategies, and both natural as well, natural and hormonal as well. You can you can prevent these stages, and also if you have developed this, you can also get it treated you by following specific strategies, which also of course yoga has a big contribution here as well. So here, so usually at this time patients come ask us what tests to be done, what we need to do at this age. When you turn 45, what are the things which we need to get checked, what have to be done, where do I need to look, and etc. So this is where, which is very important for us, like as we turn 45, we have to look for a few parameters in our body. So you can so usually, as you know, we are at a risk of developing osteoporosis. You can go for a DEXA scan, you can go for the blood test, the blood test, you can go for FSH, you can follicle stimulating hormone levels, you can test your estrogen levels. You can also, you please should also go for TSH levels, because sometimes hypothyroidism and hyperthyroidism may mimic this condition, where in these cases also you might develop hot flashes, mood swings, and etc. So getting your TSH is also very important, and absolutely important is the various vitamins. You have to do vitamin D and vitamin B12. Getting these checked at this age, this stage is very, very important. And yes, very importantly, get yourself cardiac checkup as well, and also a mammogram. Very importantly, a mammogram also is mandatory, should be done. So these few things should be mandatorily done at the age of 40, 45 or so now that we understand the changes happening inside, let us discuss how to manage them. So you are not powerless. So simply daily habits can significantly reduce symptoms and improve your quality of life. So first and foremost, I would absolutely talk about, and where Madam Sheeta will also can contribute a lot here, is in stress management. So whatever you talk, whatever you share it with your doctor, or whatever you talk, and whatever the medicines are given. So whatever the best of the best medicine I give you, but you are absolutely stressed, you're not able to manage the stress, so then things can even get worse, and so if even after getting the best of the best medicine. So therefore, my first strategy would be absolutely and always is the stress management. So stress management, when you are stressed, your body releases cortisol and adrenaline, and these stress hormones makes your brain thermostat even more sensitive and triggering your hot flashes. So yeah, again, you get my point here. So that is like you're already, your estrogen and progesterone is low, and you are stressed again, and it is increasing your cortisol level, and that is again so sorry. Okay. Hello, am I audible? Hello.
Yes, doctor.
Yeah. Okay, so that is, so as I said, so stress management is very, very important. So as already, so stress can trigger the hot flashes. So and they can make your the flashes worse. So simply practicing a 5 minutes of deep breathing or mindfulness every day, you can calm your nervous system and also reduce your hot flashes. And next important is very, very important is sleep. Your sleep pattern, you have to sleep for around at least 6 to 7 hours or any. So as we know, every body is different. So what is your body requirement? Because for some 4 to 5 hours should be enough. So enough 4 to 5 hours of sleep keeps them energetic. So according to your body's need, you have to fulfill that sleep requirement. So keep your room cool and avoid screen time before bed. So absolutely a total no, please stop this. There are chances that because of the screen time, there are chances that the anxiety might increase. So we have seen a few cases here as well, where we just by reducing the screen time or just by avoiding screen time just before sleep, we have seen that there has been significant decrease in your night sleeplessness, significant decrease in night sweats and etc. So even sleep, the screen time before sleep can also add on to your symptoms as well. So therefore absolutely stop your screen time before bed, just before going to bed, 1 hour before bed. See that you stop your screen time, instead involve yourself into something very healthy, something like a chant or a meditation, or keep yourself pretty, which helps you to keep calm, listen to good music or so that should help you to calm your nervous system. And so and you have fix a proper sleep schedule. So if you sleep today at 9 o'clock, see that you sleep tomorrow also at 9 o'clock, every day in a week at 9 o'clock. So do not change your sleep timing. So keep a proper schedule for the sleep. So finally, stay active with consistent exercise. Very, very important, absolutely important. I'm not telling you that just go for go carry heavy weights and etc. The moderate weights. And I'm not even telling you just go for a marathon, run marathons and etc. Just half an hour of brisk walk should be enough. Half an hour of brisk walk is absolutely important, and a few weights, carrying a few weights are also very, very important for us. So next again, so as I said here, so stress management is very important. And other things like next would be a little bit of diet as well. So which more of the diet, so here I am not talking, as I'm just telling you about the menopause. So more of Ayurveda, how you can deal this through Ayurveda, which I'll be dealing in the next sessions probably. So here I'm just giving you a gist on regarding what is menopause, and a little bit of a gist of how we can manage it in a right, by following the right strategies here. So next, coming to nutrition and dietary fuel. So I'm not giving you a very precise diet here, which I will be dealing with it in the probably the later sessions as well. So what you eat becomes even more important during and after menopause. So food is not just a fuel, it is a natural way to support your body's changing metabolism. So food has a very, very important contribution for us. Food has a very important it is absolutely valuable for us what we eat and what we give to our body. So here first we have to prioritize the calcium and the vitamin D3 level. So think of your bones, it is like a bank account. So you're losing this calcium bones from your account, so therefore you need to again replenish your bones as well. So to protect them, make sure that you have enough calcium, and it might be dairy, so the milk products, also green leafy vegetables, it might be ragi, or you can talk to your doctor if you have you can talk to a good doctor and ask what can be taken, and so which also I can help you out in the later sessions when I'll be precisely talking about what diet we can follow. And this I'm just giving you a vague idea what can be done here. So next, second, try incorporating phytoestrogens. So we have this beautiful thing in our nature itself. So there are phytoestrogens, that is, these are plants which has estrogen like properties. So right, so there is where Ayurveda can help us a lot. So in Ayurveda we have quite a lot of herbs which have phytoestrogens, which gives us the same effect of the estrogen. So phytoestrogens, which is also available in a lot of our food as well, like the flax seeds, like agasse, what we call it. So that is athasi, the flax seeds, and we have sesame seeds, the soy, and a few lentils which have these phytoestrogens. So this also helps in, incorporating this in our meal would help us quite a lot. So they look similar to estrogen and can gently bind to our body's receptors, helping to naturally ease our hot flashes and etc. So finally, make sure you're getting your lean protein. So lean proteins which are high in amino acids and low in fat. So you should also get lean proteins, which is very essential for maintaining our muscle mass and supporting a healthy metabolic rate and keeping you feeling full. You should avoid you from feeling full. So lean proteins also are very very important. It might be your low fat yogurt, yogurt is nothing but dahi which you keep overnight, and that can be used, and your low fat paneer can be used. So all these are lean proteins. Fish, they are lean proteins, so this can help you as well, pretty much, for lean protein and for a good muscle mass as well. So here usually, so here also we get a lot of patient trying to telling us that they are trying to lose weight, they try cut down the meals, and they are just on salad, but they still feel weaker, they feel colder than, they feel very weak than, so that is where we try to talk to them. We ask them what kind of diet they are following. It's not just that cutting down your meals, you should add proper nutrients to the meal. It is not just you cut down that I eat 4 chapatis, I'm having 2 chapatis. No, it is that you have to add what is required. You should add enough the calcium, you have to add enough, calcium rich food. You should have enough carbohydrates, you have to add enough proteins in your meal. So we need to prioritize these phytoestrogens, we have to prioritize lean proteins, etc., in your diet, so that you can protect your muscles, along with being you have healthy fats and support your also hormone production. So next is about therapies. Next, please. So sometimes lifestyle and dietary changes also are not quite enough to manage severe symptoms. Sometimes it might go haywire, sometimes it might be absolutely not in control. Even with these, even a few natural strategies, even your medicine, it might just go haywire. So that time, what comes to what is accepted these days is the hormonal replacement therapy, which is also called as HRT. So they work by gently replacing the hormones, replacing your hormones. Your ovaries are no longer which are producing, so it remains the gold standard treatment for severe hot flashes and night sweats and preventing bone loss. So while older studies, they would, olden days, like in older back here, or 5 to 10 years, they used to not support it, but now a lot of studies are going on supporting these HRTs. And our HRT is not it's not, you cannot directly, you don't have to directly jump into this HRT. Talk to your doctor, talk to your gynecologist, is it absolutely necessary? Only if it is necessary, you can go for this. So it is proven to be effective, and there are a few non-HRT, non-hormonal therapies options as well. So they include targeted prescription medicines for hot flashes, like symptomatic. So if you have hot flashes, you have medicines which is targeting hot flashes. They are nothing like hormonal, they are not hormone replacement therapies, they are like very symptomatic. So if you're not able to sleep properly, so you're going to get medicines which are going to help your sleep patterns. So your anxiety, so you're going to have medicines which are going to help you in your anxiety. So this can be done naturally as well. You can also resort for the modern medicines too here. So usually what happens is, usually there are a few patients who are not so willing to go for HRTs, and so that time they come here, they try to ask for natural ways, they try to ask for ways, where how we can manage in Ayurveda and etc. So that can be also done through following Ayurveda and yoga. I would absolutely combine Ayurveda and yoga to tackle this issue of menopause. And next, debunking a few myths. So as you know, we are also, when it comes to menopause, we have quite a lot of myths as we see. So here we say that the first myth is life becomes less vibrant after menopause, they say. And this is absolutely not true. This is absolutely not true. Historically, many cultures have celebrated this transition as second spring. They call it a second spring, a powerful time of life where you are free from monthly cycles and you can focus on your own goals and your passion. So as you can see, a lot of, now they say that, the 45 is the new 25 also. So the second myth is the hormone therapy is mandatory for everyone. No, absolutely no again. So there is no one size fits all approach here. Every woman's body is unique, and many manage this transition beautifully through simple lifestyle and dietary changes. So finally, the third myth is that the weight gain is permanent. No, absolutely no. So while your metabolism does shift, you can absolutely support your body by focusing on muscle building exercises and eating protein rich and nourishing meals. So usually even people say that, sometimes they break down, sometimes patients break down, they say that I feel very outdated, I feel very old, and etc. So that is where I think very important is for us to counsel them, talk to them, understand. It is just that they have to accept that it happens to everybody, every female, every woman goes through this, and this too shall pass, right? So this too shall pass. And so next, so while, as I said, while menopause is a natural transition, so there are certain signs and symptoms that we should not ignore. As a doctor, I want to make sure that you know these red flags. So first and foremost is the post-menopausal bleeding. So if you have gone a full year or without a period, and any bleeding or spotting, even in a tiny drop, requires a prompt evaluation by your doctor. So while it often it's caused by harmless thinning of the tissues, we must always check to rule out any changes in the uterine lining as well. Second, keep track of physical changes. Understand your body, keep an eye on your body. So be proactive about scheduling your routine mammograms and seeing your doctor if you notice a few breast changes, sudden weight loss, or persistent abdominal bloating. Please consult your doctor. And finally, pay attention to your mental wellness. Absolutely important, very, very important. Severe mood swings, deep anxiety, or feeling of hopelessness, or not things are like you don't feel like, there are things sometimes you don't feel like, you don't feel like living, you don't want to live. So, some extreme kind of, thoughts should be taken care. So your mental health is just as important as physical health, and support is always available. Right, so again here, so let's keep talking about this. So as we wrap, so I would like to wrap this session. I think this is pretty much enough for us to understand what happens in your body, what you're going through, and how you have to be cautious in just a bird's eye view of this. So as we wrap up this session today, I want to leave you with a simple truth. Menopause is not the end of the chapter. It is the beginning of a new one. So it is a transition to be stepped into with confidence and supported by science and a caring community. So when you have the right support and information regarding this, I think you don't have to fear the change. And I want to share a short clinical conversation, and I've already shared a few conversation that, whatever we have spoken, like whatever we usually have a dialogue with patients and etc. Usually so let no woman should feel outdated, or nobody should feel left out also. I want every woman to accept this change, celebrate this change, and take absolute strategies with help of natural strategies, with help of wonderful people like Sheetal and team. They're always there for us to take care of our mental health, and also help us